My name is Leah Tolentino and I am a student from University of Manitoba and I'm going to administer a medication through a mini bag. So I already compared the doctor's order against my mark and I've also grabbed my medication from the Pyxis machine and I'm just gonna do my first check. So for Wrightson Emma, which is 1, 2, 3, 4, 5, 6, 7, 8, 9. For allergies, no known allergies, the medication I need is vancomycin. And in my vial, I have vancomycin, making sure it is not expired and there's no constituents in my vial. And the dosage I need is 500 milligrams. And my medication says 1 gram, so I can use this given through IV, which is the medication is compatible through IV route and given every 12 hours. So now I can go to my monograph. So I have vancomycin, which is an antibiotic, and it can be administered by a student nurse. And the safe dosage would be 3 grams. So the dosage that I only need is 500 milligrams, so I can administer this medication. And I'm just gonna check for compatibility. So according to my monograph, it is compatible with C5W, normal saline, dextrosaline. So I have a primary of normal saline. It is safe to give this medication. And I'm just gonna check the side effects. Okay. So now I'm going to start to prepare my medication. I'm gonna do hand hygiene. So according to my drug monograph, it is supplied 500 milligrams per 1 gram. I have 1 gram in here. So I'm gonna follow the 1 gram instruction. 1 gram, add 20 ml of sterile water for injection. Final volume would be 20 ml. Final concentration would be 50 milligrams. So I'm going to begin with cleaning my vial.
And I'll do my safety check, patient's not distressed, but closed position, no safety.
I'm gonna clean that for good 30 seconds and let it dry for 15. And while waiting for that, I'm going to prepare my needle. So I have 20 ml, doing the banana peeling method, as well as with my blunt needle. So I'm just gonna leave this here. And then I'm gonna get my sterile water. So sterile water, making sure it's not expired and it's okay to use. I'm just gonna grab 2 to make sure that I can have the exact dosage. Sterile water, it is not expired and it's okay to use. So I'm just gonna clean both vials for 30 seconds and let it dry for 15. And I'm gonna clean the other one for 30 seconds and let that dry for 15. So I need 20 ml of sterile water. So I'm gonna inject here. I'm just gonna inject 10 ml in here. So I'm gonna put my cap where I can maintain it sterile. So I can inject. I'm gonna inject my air.
How much time do I have left here?
So I'm just gonna remove this and pull back my volume, and now I'm going to use this one, the sterile water. I don't have to clean it again. I cleaned it earlier.
There's water in here.
And I'm just gonna grab 10 ml.
Hello, my name is Rika Ambao. I'm a surgery nursing student and I'm here to give an IV medication via Minifine. So I have my mark here.
I'm just gonna tap away my bubbles, making sure I have the correct one.
Hello, my name is Rika Ambao. I'm a surgery nursing student.
And put this aside.
IV demonstration.
And then I'm gonna put my sterile water in my medication. I don't have to clean it again. I cleansed it earlier and I am sure that I didn't contaminate it.
And she was born on June 4th, 1963.
I'm gonna inject my sterile water.
Medication IV every 4 hours. So I have it here. So my medication is penicillin G sodium, and I have 5
And I'm just
units
gonna
in
let
vial.
air
And so
go to my
that's 3
syringe
million units.
and recap my needle and put this somewhere sterile. And now I'm going to mix my med, mixing it slowly, making sure that it's well mixed. And now there's no more constituents and I can use my medication. So based on my calculation, the dosage I need is 500 milligrams and the concentration I have is 50 milligrams per ml and the volume I will need is only 10 mLs. Therefore, I'm going to inject 10 mLs of air to my medication. I'm just gonna clean my vial again because I'm not sure if I have touched it earlier. Clean it for 30 and let it dry for 15. I have 10 mLs of air.
So I have my mark here, which I already compared to the doctor's order. I have my
I'm
patient.
gonna inject my air
She was born on June 4th.
and then I need 10 mLs of the medication.
And my medication is penicillin G sodium. I have penicillin G sodium here, which I
I'm just
already
gonna tap away my bubbles.
So I already confirmed the right patient and the right medication, which is penicillin G sodium. I have 3 million units in my order, and I have a 5 million unit vial here, which needs reconstituted. I already did my math prior, and I'll
10 mLs, making sure I have 10 mLs and I don't have any
So that's the right dose.
bubbles.
And I have IV. Sus can be given IV, so that's the right route. To be given every 4 hours, and it's due right now, so that's the right time to give it.
10 mLs
And it's
and
not
there's no
expired as well,
bubbles.
so
Okay.
we can give this, and I will be checking your parental electronograph. So this is penicillin G sodium, and it's an antibiotic. So the right
I have my needle here.
And
I'm not sure if my needle is still safe to use, so I'm just gonna grab
so that's the right reason.
one from the blood flow needle.
To be given by students. And the usual dosage is 2 to 4
gonna-
million units IV every 4 to 6
And
hours.
put this in my sharps container.
Single dose of 5
I'm just
million
gonna
units.
recap my needle.
Dose for that, and needs to be reconstituted in 8.2 ml normal saline with a final volume 10 ml.
So before I further move on, I'm just gonna do my second check. So for my second check, I need my vial, my syringe, and my mark. Right side Emma, and then the medication I need is vancomycin, and I have vancomycin in here. The dosage I need is 500 milligrams, and I have calculated earlier that I need 10 mLs. I have 10 mLs in here, making sure I don't have any bubbles. Here's my 10 mLs, so correct dosage, given through IV, and then the frequency is every 12 hours, and I can administer the medication now. And I can now further dilute my med. So according to here, IV intermittency, dilution, and administration table number 1 below. So I need 500 milligrams. The format would be 100 ml mini bag normal saline. Final volume 110 ml. Final concentration 4.5 milligram per ml. Administered over 30 minutes. So I have my normal saline. I have 100 ml. Checking the integrity of my packaging, making sure it is safe to use. So yes, I can use this one. And I am going to clean my port.
Here, and then I'll be getting 8.2 ml.
I'm gonna clean it for 30 seconds and let that dry for 15. I'm just gonna do hand hygiene again to make sure everything is clean.
I have my normal saline here.
And now I'm going to inject my medication.
Just that.
Injecting it slowly. I'm gonna throw this at the sharps container, and now I'm going to mix my med to make sure that it is infused well, and that's okay now. And I am going to label my medication. Now I'm gonna put everything in my medicine cabinet, and I am ready to go to my patient's bedside. So I need my MAR, my medication, my secondary tubing, and some alcohol swab. So I'm just gonna do my hand hygiene, knock, 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 doing my entrance safety check, and making sure that everything is okay and my patient is not in distress. Hello, Miss Emma. My name is Bea, and I am your student nurse for today. Is it okay if I check your wristband? So checking the wristband, right to Emma, date of birth, month, date, year, and checking for allergies. No known allergies. My patient does not have an allergy band. Is it okay if I get your first and your last name? Thank you. And your date of birth? Thank you. And would you have any allergies? Doesn't and have allergies. So I'm gonna give you your medication, and before I do that, I'm just gonna do my third and final check. So I have for my patient, Wrightson Emma, medication is vancomycin. I have vancomycin. The dosage I need is 500 milligrams. I needed 10 ml, and which is diluted with 100 ml with a total volume of 110 ml, and given through IV. And I'm gonna give it through mini bag and given every 12 hours. And I can give the medication now. And the reason for giving this medication is for Miss Emma's cellulitis. So for patient education, Miss Emma, I'm going to give you vancomycin, which is an antibiotic to help your cellulitis. Some side effects you might experience is nausea and vomiting, and you might experience pain in your IV site. So if ever you do feel any of those side effects, here is the call bell. You can call us. And is it okay if I give you your medication? And around this time, the patient did not refuse, so I can further move on to my procedure. And before doing that, I'm just gonna check the side, the IV side. Are you feeling any pain right now? No pain. There's no swelling. Making sure that all clamps are open. And my primary is running. My tubing is not expired. I have normal saline in here. And now I'm just gonna do hand hygiene. And I am gonna lower down my primary tubing.
And I have 10 ml volume.
And then,
Concentration 500,000 units per ml. And
so by keeping it sterile, I'm going to label.
within 15 to 30 minutes of choosing the 100 ml over 30 minutes.
I'm going to label my tubing, and I am gonna close the clamp.
And also check.
And now I'm going to spike my bag by keeping it sterile.
So I will just do my reconstitution here. So first, I'm just gonna wash my hands. Have my
Just
bio
gonna
here,
put this aside,
as well as my normal saline.
and I'm gonna make sure that my tubing is clamped. I'm just gonna add this first. And now I'm going to attach my secondary tubing to my primary tubing. I'm gonna choose the port that is above the Baxter machine because I want it to be controlled by the machine. So I choose this one. I'm gonna clean the port for a good 30 seconds and let it dry for 15.
For each of these, I will be choosing separate alcohol swabs. But
And then I'm gonna attach the two by keeping them both sterile.
15, as well as this one. 30 seconds has passed. Let's throw it out. I'm gonna get my syringe here.
There you go. I have attached them both. And now I'm going to do secondary.
I chose the 10
And my rate would be, I wrote it earlier, I have calculated earlier, it will be 220.
Amount that I will have to
Hold
touch.
on. Before I do that, I need to back prime my tubing first. So I'll press primary. So I'm gonna back prime, making sure there's no bubbles in my tubing by lowering it down and making sure I fill up my chamber at least 1/3 to 1/2.
Inject that.
So yeah, that's okay. I'm gonna unclamp it again. So I have back prime and my chamber is filled. I'm going to do my secondary 220 ml per hour, and the volume is 110 ml. I'm gonna confirm my rate, and I'm going to start. And according to my Baxter, it is supposed to be given by 30 minutes, which is what the monogram has said. And now I am going to unclamp, making sure that I have 3 drops. So I saw 3 drops. So making sure everything is unclamped. It is infusing, making sure this is unclamped, and also this one. And also assessing the side. There's no swelling. Are you feeling any pain right now, Miss Emma? No pain? So that's all the medication I have for you right now. And if you do feel any of the side effects I have mentioned earlier, here is the call bell. So you can call me. And then I'll be coming back within 10 to 30 minutes or so to make sure that it switches to your primary, and also to assess your cellulitis and your vital signs. And before I leave, would you need anything? No. So I'm just gonna sign my MAR. And then I'm gonna clean my hands. And as I do that, I'm going to do my exit safety check, making sure that nothing is on the ground.